when we are working with structural conditions, we have to be very precise and very accurate with our structural assessment. Where exactly are you in pain, if there is pain? Where exactly in the lower back? Where exactly in the hip? Where exactly in the shoulder? Where exactly at the knee? Inside, outside, etc. So we have to be very precise with the asana, whether we will strengthen the leg in external rotation or internal rotation or whatever. So we have to be very precise with the structural assessment in order to give a very appropriate asana, a very appropriate modification of the asana, whether we have scoliosis, a double, a single, 3C, 4C, whatever. So whenever we have structural conditions, really the main focus is to have good eyes and to try, how does this feel? How does that feel? Better, release, more, at ease. So we have to be very careful with the structural assessment in order to try few asanas that work at that part of the body and to modify the asanas in order to accurately work with these muscles that are injured or tight or weak or whatever, or overstretched. And for this, we might incorporate a restorative that with the gravity release some tension from the area of the body that is affected. And the appropriate restorative also will work passively what the asana will do. And on top of that, we might incorporate some breathing that might facilitate better pain management by enhancing a little bit the exhalation, mostly by. So if there is chronic pain, we need to work also with the breathing. But in mental health conditions, our priority is the connection with the client, to really hear the client and based on their words, how they feel, to feel what they feel, to understand what we have to shift. This is first. So again, the diagnosis, whether I come with panic attack or with depression or anxiety, of course, it's not enough. Like it's not enough when they say, I have my knee. Okay, you have your knee. What does it mean? You have discomfort or pain. When? After you wake up, after you come up on the stairs, after you come down from the stairs, inside, outside. So the knee is not enough. The depression is not enough. We have to hear how do they feel. Again, when do they start? What are the symptoms, etc., etc. So one good intake will lead us where we connect and we hear what they feel. We pay a lot of attention to the words they use in order to know whether they feel unsafe, whether they feel unworthy, whether they feel that they lose the enthusiasm about life, broken heart, etc., scattered, whatever. So we're very careful in the intake, as always. And the most important thing when we have mental health issue is the breathing assessment. The breathing assessment, because through the breath, we will regulate our nervous system. We will release our tension, our restriction, our sadness, our fears, first by facilitating a slow breath. When we are stressed, when we are sad, when we are afraid, when we are in panic, we have very fast and shallow breath. So we need to focus a lot on breath, on breathing slowly. What is the most affected part? The inhalation or the exhalation? Working on the most affected part usually restores both parts of the breath. So the breathing assessment is the most important. The pranayama is the most important at the beginning or at the end of the practice, and the breathing ratio during the practice. And in order to release the sadness, where is embodied? In the chest, in the ribs, in the belly? Where? Where is the restriction? We probably need a practice that will facilitate this breathing pattern. So if I need to enhance the inhalation, is obviously I will have to lift the arms, I will have to open the chest, etc. If I need to focus on the exhalation, but there is also a restriction in the chest, I have to work on the twists, on side bends. Practices that enhance the exhalation but also open the chest. So the practices, the asanas, should support the breathing, should facilitate the breathing. So the most important thing in the mental health conditions, wherever the priority is their mood, is the breathing. On top of the breathing, we can have the positive affirmations and the yoga nidra and the meditation. We might have the restoratives in order to facilitate effortless breath. And of course, the asanas should support the breathing that they need. So in the structural conditions, the most important is the appropriate, a good structural assessment that will reveal exactly what asanas should be tried and the modifications of the asanas. Because in yoga therapy, we use more or less 30 asanas. The modification of the asana, the creativity of us will make the asana the most appropriate for this body. And then the restorative probably is the second most important for any structural condition. For the mental health, the most important is the breathing assessment. And the second most important probably would be a positive affirmation or a restorative again that will bring rest in the body and in their mind. Because when you are rested, you can see more clearly. And a restorative that you feel safe to stay, and you might see more clearly and feel more in control, more empowered. Or you might have a more positive view, clear view. And of course, the positive affirmations can shift from the negative to the self-limiting to the positive. Neutralize at least the effect of the condition or of the thoughts or beliefs that have been in our minds, in our hearts, for long affecting our mental health. So, as this is a small review I want to do in order to put things in a perspective before I go to the mental health.